These are tiny bubbles that are secreted from different cell types in our human body. Patients in need worldwide in different hospitals can take, hopefully, the next few years these treatments without any delay. So we are introducing something that is like small scale. They can be infused systemically or locally.
Thank you to the International Society for Cell and Gene Therapy for supporting Onyx Live.
I am Federico Citterich reporting for Onyx Live here in Dublin at the ISCT. This morning we are joined by Dimitrios Kouroupis, professor at the Miller School of Medicine of the University of Miami. Dimitrios, good morning.
Good morning.
Thank
nice
you
to
for
meet
joining
sir.
us.
Yes, thank you very much for the invitation. I'm a professor at the University of Miami. I'm living there the last almost 10 years. I joined the University of Miami because it's a very strong institute in the USA. We are doing stem cell research. We are focusing all our efforts to reverse different types of musculoskeletal pathologies. I'm part of orthopedics department, so this is our main focus. I attended this meeting because it's highly focused on these tissue engineering regenerative medicine technologies. And it's a very important opportunity for us to expose our work and our research and new findings and new drugs that are produced in Miami.
So I think it's fair to say that your work connects also different areas. So for instance, orthopedics, pain, neuroinflammation, and of course exosomes. So first of all, I wanted to ask you, how are those connected?
Yes, that's a very important question, to be honest. They are highly connected because we're interested in reversing inflammation, fibrosis, and pain in orthopedics. This is something that is high demand worldwide. We need new drugs. We have some NSAIDs, we have some steroids, old-fashioned approaches. They have a lot of adverse effects, especially the steroids, so we need some new drugs in order to reverse all these indications in the human body. We are mostly focusing our efforts on tendinopathies and osteoarthritis in Miami. And specifically for osteoarthritis, for OA, there's a high demand of new drugs for anabolic effects, regenerate cartilage, to ease pain, attenuate inflammation. So it's something very important, to work on this field and find new approaches for therapeutics.
Exosomes are sometimes presented as cell therapy without the cells. Do you think that's a good way of putting it, or is it perhaps oversimplifying it a bit?
No, this is a very good way of putting this in context. Exosomes were discovered maybe I would say 20 plus years ago, but in the regenerative medicine and tissue engineering field they were introduced the last 5 to 6 years. So worldwide the community is highly interested in exosomes. These are tiny bubbles that are secreted from different cell types in our human body. They can be isolated and they can be secreted from stem cells, and this is exactly what scientists are doing nowadays. So they're expanding the actual cells, they're collecting these exosomes, and then they can load them with therapeutic attributes, therapeutic like drugs, molecules that can reverse all these indications in the human body. So it's a new technology, it's very interesting. In my opinion, it's going to develop highly the next 5 years, so we're going to see a lot of new drugs coming out of this exosome-based therapeutics, and especially in musculoskeletal and orthopedics field. As I told you, there's a high demand for new drugs, so we can generate injectable therapies, the so-called orthobiologics, so you can locally inject these exosomes, the cell-free approach, and you can have a tremendous anabolic and immunomodulator, as we say, so to dampen the actual reaction of the immune system in the human body. So it's something very, very promising for the next years.
Here in Dublin at the ISCT, exosomes, maybe we can say that sit a bit outside of the natural and the normal cell therapy narrative, but do you feel like the field is getting more attention? There's a whole floor about it.
Exactly, you're totally right, yes. It's getting more attention, yes. And the interesting thing is that there are different cell types that we can isolate these exosomes. People are using, parental cells like stem cells. These can be taken from different tissue sources, like umbilical cord, for example. Maybe you have heard about the collection of stem cells from umbilical cord, from adipose tissue, subcutaneous fat, from bone marrow. So there are different tissue sources. This is one side. On the other side, you can have also cell lines. So scientists are growing cells in large numbers, in large scale, so you can have a continuous production of these tiny bulbs of these exosomes. Whenever you need them, they will be ready to be used, therapeutic doses. So patients in need worldwide in different hospitals can take, hopefully the next few years, these treatments without any delay. So this is the advancement, and this is what we discussed here in this conference, to be honest, with different groups worldwide.
I wanted to finish off with perhaps quite a funny one.
Please.
If you were trying to convince a skeptical physician or clinician that exosome-based approaches actually are more than just a promise, what would you tell them?
Yes, I know. To persuade the clinician is not very easy task. And I mean, they're right in one way because, you know, they have to be skeptical, they have to treat properly their patients. They cannot just introduce in the human body something that is not regulated. And this is where we come in. We are trying to assess the safety of all these therapeutic approaches. But the good thing with exosomes and this extracellular vesicle field is that they are cell-free. I mean, we are not talking about introducing something that is living. So we are introducing something that is like small scale. They can be infused systemically or locally. It can be loaded with specific drugs, and it doesn't have a lot of adverse effects for the patient. The patient is always in our mind. We want to give, good medication to the patients for different indications. So this is how we are moving forward. We're assessing first the safety, and then the actual effectiveness of the treatment. And this is how you can approach a physician, and you can explain him exactly how it works, the mechanism, the biology, and how it's going to treat the specific indication the patient, if it is about MSK, cardiovascular system, whatever is the actual indication you want to treat.
I think they'd be persuaded.
Yes, I think so.
Dimitrios, thank you
Thank you very much.
Thank you very much for your
time. Thank you very much.